Hey guys, welcome back to another video. I got Dr. Tyler here. I'm going to be working on him now. Again, this is the next video in the shoulder series, so make sure if you haven't seen the previous video where we worked on the pecs to address rotator cuff issues, you go back and watch that one. It's going to be in the description below. Just go down there and click the link. You really want to watch that one first before this one, so it gives you a good idea on how we treat the whole structure, all of the muscles, and because the pecs play such a huge role in rotator cuff issues, it's a really good idea to watch that one first. So now that you've seen that video, we're going to be starting on the posterior rotator cuff muscles. These are the ones that are in the back. So it includes the infraspinatus, the teres minor, and even a little bit teres major underneath that. So we're going to be working on those guys. The way we're going to start is actually by using the vibrocussor here. So this is kind of like some of the massage guns you might have seen that some people are buying now, except it's a lot stronger. It's about 10 times as strong. So it gets really, really deep into the muscles and helps to really break them apart and loosen them up very effectively. So we're going to start right underneath the border of the scapula here with the infraspinatus. Just breaking up those fibers there. The reason we want to do this is when you have chronic rotator cuff issues, not only can the tendons get inflamed, but they can become really tight and consolidated. And what happens is when they get really tight and they pull, they can start rubbing on the bone and creating friction. Then when you use your arm, they can kind of fray on the bone, and that fraying or them rubbing on the bone over and over can cause even more inflammation and pain. So we really want to loosen these guys up and restore the normal range of motion so that Dr. Tyler here can use his arm just like he should, with full motion, uninhibited from restriction. Alright, so now that we got his back muscles, his back rotator cuff muscles to be a little softer here, we're going to start going into some ART type moves where we pin down the muscle and then we go through some ranges of motion to stretch. What this is accomplishing is I'm pinning down certain muscle fibers, and when we go through the stretch, it allows them to kind of break apart from one each other, and any adhesions that have formed, any fibrotic tissue, any type of restriction at all, this really helps to get it gliding and flowing without that tightness and restriction that he might have otherwise. So what I'm going to get him to do is to pick his arm up. He's going to start in this position, and when I'm putting pressure here, he's going to push his arm forward and then bring his thumb down, and that's going to maximally stretch these rotator cuff muscles back here. So we're going to go back. I'm going to put pressure, and then he's going to go forward and down. Perfect. And come back. And again, this pin and stretch type of technique does a really, really good job at loosening these muscles up, breaking apart adhesions, allowing his shoulder to really feel more like normal. Usually after we get done treating people with rotator cuff issues, they start swinging their arm around. They can't believe how free their shoulder feels, and because it hasn't felt like that in a very long time. And that's just because of how deep of a technique this is and how effective it is at breaking apart these muscles. Alright, so now that we finished working on the posterior rotator cuff muscles, we're going to have Dr. Tyler sit up and work on the supraspinatus. Just so you know, sometimes with these posterior rotator cuff muscles, what we will also sometimes do is Graston therapy. We're not going to show that in this video, but that'll be in upcoming videos. So now let's have Dr. Tyler sit back up, and we'll start on the top rotator cuff muscle. Alright guys, so now we're going to start on the supraspinatus. The supraspinatus is the most superior or top rotator cuff muscle in the shoulder, and it's also the most common of them all that gets injured. It's the muscle that if you're throwing, if you're pitching, it's the muscle that has to stop your arm, and so it can get inflamed and even tear in some circumstances when it gets really tight and overused from too long. That's the common muscle that pitchers are known to tear, for example. So we really want to make sure that this guy's loose, functioning properly, so that you have full range of motion in all your shoulder, and also that it's not impinging when it comes out and inserts into the side of the shoulder here. It goes over bones and ligaments on the side like a little tunnel. It kind of goes underneath that, and we want to make sure it's not getting caught up in there by being really tight and consolidated. So we want to loosen that up. The way we're going to do that is start with some ART again. We're going to have Dr. Tyler raise his arm up into the air, and he's going to do this where his arm is going straight up and his palm is facing inward towards him. I'm going to put some pressure right on the supraspinatus, which is right underneath the trap here. And when I'm applying pressure, he's going to go down and behind his back to really lengthen and stretch out that tendon. And then come back up. We're going to do this a bunch of times. What we're doing right now, what we're accomplishing, is I'm holding the supraspinatus in place. So it's having a hard time actually moving, but his shoulder is moving down. So that's going to create a huge stretch that tugs and pulls on that supraspinatus, getting a really deep stretch in that muscle. And this is a muscle that it's really difficult to stretch yourself. There's really not a really good way to do it on your own. So this muscle, if it does get tight, which is very common, it's really difficult to loosen up on your own. And that's why the ART move here just does such a good job at loosening this up. This is definitely one of the most powerful ART moves of the shoulder. So this DMS stands for Deep Muscle Stimulator, and this is a big metal tool that vibrates back and forth. It's similar to the vibrocussor we already showed you, but it gets super, super deep into the muscles. It's very, very intense. And the reason we're going to use this on the supraspinatus is because it kind of sits in a little groove or cup, and it's very difficult to get to the bottommost fibers of the supraspinatus, of that muscle. So this does a good job of piercing all the way through and loosening up really, really well. So we're going to start by just putting it on the supra right over the trap. If the patient has any neck pain associated with their shoulder pain, sometimes I'll have them do some neck ranges of motion as well, kind of stretching off to the side like Dr. Tyler's doing right now. And again, this is a very, very powerful tool that gets very, very deep into the muscle. Most patients are quite surprised just how powerful this feels if they've never felt it before. All right. So that is the basic treatment for the shoulder that we do in the office here. Again, every patient's going to be a little bit different in what specifically is going on with them as an individual. They might have problems in the front with the bicep tendon, they might have problems on the side with the supraspinatus, and there'll be different types of focus depending on what their actual condition is. But as a whole, this is kind of the meat of the treatment. There's always going to be stuff that you can also do at home, and that's going to be very, very important so that you stay healthy and that you actually become very pain-free and don't have to worry about your shoulder anymore. That's going to be on separate videos as well. In the next video, what we're going to do is we're going to start going into some other conditions like neck pain and upper back pain, and things that we do in the office to treat that, as well as things you could do at home as well. So I hope you enjoyed this video. If you have any questions, you can always reach out to us at Back in Motion in San Diego. And if you want to go to our main channel and just check out the other videos we have there, feel free to do that as well. Alright guys, have a good one.
Peace out.